you struggle with weight loss, you're not alone. Don't worry. I'm here too. I'm here. We go through the same thing, especially after childbirth. And even when you hit the age of 30, losing weight is not as easy as somebody who is in their 20s or in their teens. Now, when you hit the 40s, it's even worse. And you ask yourself, I'm doing everything I was doing when I was in my 20s and I was losing the weight, and I'm still not losing the weight. Then your blood pressure keeps going up. You might, be told that you have high cholesterol or you are diabetic. How do you lose the weight? It's simple now. Worry no more. There's this new trend, semaglutide. It's here. It's here to help you. But you know what? Don't just go to anybody for it. You ought to go to the right people, the professionals, to make sure they give it to you so you don't have any side effects, and also you'll be grateful that you went there. My guests for today are two medical practitioners who are here to help us understand this new trend that you need and I need, which I'll be taking very soon. I'm here with Dr. Abigail Donkor. She is a doctor of pharmacy, PharmD. Doc, welcome.
Thank you.
How are you?
I'm doing great. How about you?
I'm fine, thank you. And also Nane Mensa. She is a nurse practitioner. Hi, Cha.
Right. How are you?
I'm good. How are you?
I've been well.
All right. So thank you so much for being here. You're a lifesaver.
We're trying.
You have no idea. You're a lifesaver. When I heard about it, I'm like, oh my God, finally. So you go to the gym, your whole body is aching, you are sore, and sometimes the killer part is when you're not even losing the weight.
I'm telling you.
And you're asking yourself, my goodness, what's happening?
What else can I do?
What else can I do? So now tell us a bit about this new trend of, the latest way to lose weight. What is it? Let me start with Abigail.
Okay, so there's this medication which semaglutide and tirzepatide.
Okay.
It's for, you can use it for medical weight loss. And it does amazing. It works on different parts of the body. So it's once weekly injection.
Okay.
And when you start this, we still encourage you to exercise and, of course, eat a healthy diet. So it's like a holistic approach. But it makes losing weight so much easier. It works on the brain. When you get your once weekly injection, it minimizes your cravings. So you're not eating like 3 or 4 times a day. It suppresses your appetite.
All right.
You always feel like you're full. And the least amount of food you eat, it stays with you for a longer time. So when it works on the stomach, it causes something called delayed gastric emptying. And what that means is the food stays in the stomach for a longer period of time. So let's say you eat a bowl of rice and it stays in your stomach for, say, 3-4 hours. When you are on semaglutide, it can stay with you for like maybe up to 6 hours. So in a day, if you're eating like 3 times, you eat once or twice, and you're full. You're full for a long time. When the food leaves the stomach and it gets into the small intestine, it causes something called reduced motility, which is like the movement of the food through the intestine. So it slows down the process. So you always feel like you're not hungry. You're always full, and it's such an amazing feel,
Because, you see, the biggest thing is always craving. I see somebody eating fufu, I want to eat. Somebody who posts wache, I feel like, oh, this
you
has
would not even be interested.
You see gobe, I want to eat that gobe.
Yes.
So now you're telling me that I can have an injection that can cut the cravings.
It's going to cut it. And it's like, you're not going to crave for it anymore.
But how?
It works on the brain.
Okay.
It works on the brain. And it works on different parts of the body. So it works on the brain to curb your appetite. It reduces your satiety, which, increases your cravings.
Now, we heard that this is very common, in the West. The one thing I always say, my people, us, we are scared to try new things.
True.
Some people will say, oh, if I take this injection, there's side effects, I'll be so affected. And yet we are eating food that is harmful to our health.
Yeah.
So how do we convince people out there that, listen, in the West is out there, almost everybody's taking it. You are a doctor, and so you should even say, stay away from this because it's not healthy for you.
Okay.
But as a doctor, you are even encouraging us to take it. So how do I tell my people?
So what I tell a lot of people is every medication under this planet has adverse effect. you have to go to the right place. You need to go through consultation.
Right.
When you come to our practice, we sit you, and this is not for everyone. There are contraindications, there are adverse effects, but we make sure this is right for you before you start on it. That's why it's very important that you come for consultation.
Okay.
And we make sure that you are an eligible candidate to get this medication. There are adverse effects. There are some common adverse effects which are very tolerable. The common ones is nausea, vomiting, diarrhea, or constipation.
Okay.
You know, but these adverse effects, they even go away with time because we educate you what you need to do. It's very huge, it's very big that you stay hydrated while you're on this medication. When you are hydrated, the nausea goes down, the vomiting goes down, and it helps a lot with both constipation or diarrhea. So these are like the most common adverse effects, and these are these are adverse effects that goes away with time. And some people don't even experience these at all.
I heard
because
about
our
that
bodies
as well.
are different.
Yeah.
Some people come in, I just felt like I was full the whole time.
Yeah.
It's like I have to even remind myself to
That I have
eat.
to eat.
Yes.
Right.
You know, before these, and this is in a class of medications called GLPs.
Okay.
And before these, the other ones that were there, it used to cause kind of like anxiety, like it makes you like a little jittery. And this doesn't have that effect. You just feel great. You just feel great.
Okay, so I know you're home, you're still wondering, should I still take it? Should I not take it? Don't worry at all. We are still explaining because you see, yesterday I met a lady and she was like, she has a headache, and I said, take paracetamol. She said, I'm allergic to paracetamol. I'm like,
dear.
okay. So even paracetamol, that we call it common, has side effects that you can be told that you should stay off paracetamol, meaning that taking this is not bad like we might be thinking it is. Let's talk about who can take it. I can ask you, Richard, about
Sure,
that.
absolutely. So this medicine, as long as you're 18 years and above, you are eligible to have this medication after we've gone through a thorough health history with you. If you're diabetic, you are non-diabetic, you're pre-diabetic, you're hypertensive, and you're healthy, trying to stay even more healthier, you're a good candidate.
So a diabetic can take it?
Yes, even better. We've had a couple of patients that literally have been off their diabetic oral medication. And this is all that they're using to manage their diabetes and also is managing their weight. So getting 2 in 1.
Yeah, so this medication actually works great for diabetics, like pre-diabetics and diabetics, because it also works on the pancreas, which is responsible for insulin production. When people on these medications, it helps to produce and secrete insulin into the bloodstream. So it actually helps to manage diabetes. It's FDA approved for type 2 diabetes.
Right. Anyway, but you see, another thing. Okay, let me switch a little bit. I'll come back to it. Is that the only thing you serve at your place, or you have other services that you render to people?
Yeah. So we do everything anti-aging. When it comes to skin,
I was gonna ask, so I'm not seeing any wrinkles. Like, what's going on your faces? Like, your faces are so smooth.
Yeah, so we call something prophylactic.
Okay.
You try to stop it before it kicks in, and it is what it is. I mean, no matter what we do, we're gonna age, but does it really have to show? So it's a preference.
Okay.
Some people don't want to age, some people want to age. Some people want to see wrinkles, people don't want to see wrinkles. So we are for the people that don't want to see wrinkles, or they want to look much better as they are aging. So it's all about what you're looking for.
Fine lines on your face.
Yes.
And everybody can take it, or you have to be of a certain age before you can start taking it?
Ideally, the best time you should start taking care of your skin is by age 22. Because most of these products that we use, if you're not 22 and above, you cannot use it.
Okay.
So it all depends on who you're going to and how well they're assessing you to make sure that this is safe for you or this is not. And it's not necessarily always going the hard way. There are little things like a simple chemical peel. Regular facials, or even quality medical grade skincare product can actually impact your skin. So it's not always about the hard way. Yeah.
But there's also the injection, the Botox, right?
Botox.
Okay.
So if I'm doing a good assessment on you, I'm trying to see if you're really a candidate for Botox or baby Botox. So there are different types of Botox that we can use. In the United States, it's 4 of them. So we make sure that which one in particular are we administering for you. So it will help you look natural and still control the process of aging.
Okay, right. So, because again, you know, in the past we used to see pictures of people who have gone for Botox and their faces are so stiff, but I'm not seeing that with you ladies here. Like I feel like you're like 25 years. Yeah, you can pass for that because you have fine skin and all.
Thank you.
Also talk, as we are talking about the weight loss, there is injection for the tummy as well.
Yes, so we do most of the things we do in our clinic is all non-surgical.
Okay.
Nothing invasive. We have something we call deoxycholic acid that is more like liquid lipo, and we assess you to make sure you're a good candidate.
Okay.
Because we are so much after results. We just don't put anything on anybody because they want to lose weight or something.
Because you just want the money.
Yes, exactly. No, it's not about that. It's about what will give the person result and also what is safe for the individual. So as long as we screen you and you're a good candidate, we take it from there. And we always also advocate for when you're losing weight, you're fixing the face, you're fixing the body, because you're losing fat. The skin is going to sag. You want to tighten. We have equipment, devices that we are able to use that pulls your own collagen. Very natural means by not adding anything else, which firms the skin, it tightens the face, and you're losing weight. So you get that equilibrium. It's like everything is snatched. Because most people will lose the weight and it's like the face, like, oh nah, she looks sick. Nah, I don't want that kind of face. No, it doesn't. You don't have to have that kind of face when you're losing weight. So we are more specialized in the weight loss and also making sure that everything that is happening is in balance and check.
I like that because when, you know, I was discussing the injection with somebody and the person was like, oh, when you lose weight, you change, you look sick.
Exactly.
And I don't want to have it. So I'm excited that you are saying that even as you're losing weight, we're here to help you so you don't look sick.
Exactly.
But you look very natural, you look firmed up and, you know, beautiful.
Yes.
So now again, we come back to the injection.
Okay.
You know, even especially with the one for the liquid lipo.
Liquid lipo.
Any side effects to that?
So yeah, minimal side effect with everything as we talked about, paracetamol, Tylenol, and even water. If you take too much water, your doctor, especially people with renal diseases, your doctor is going to give you a limit on how much water you can drink in a day. So it's still not an excuse to say there's no side effect. There are side effects, minimal side effect. And it comes to the question, if you go to the right clinician who knows what you're doing, they're able to help you control the side effect. Common side effect when it comes to this injection is mild discomfort, swelling, possible bruising, but most people here, melanin skin, we usually don't bruise that much. So it's not anything you can bear.
Okay.
Then we also do a lot of good aftercare to making sure that you're wearing your waist trainer or your faja to really hold the skin up for you, drinking water and moving, and you should be fine.
Now we go back to the Ozempic. How many times, you said you have to take it weekly, so how many shots do you need before you start losing the weight?
So we start with a tolerable dose just to make sure that your body tolerates it for a couple of weeks. And then once you tolerate it, we take you to the therapeutic dose. Some people start seeing effect even with a tolerable dose, which is about, someone be like, lose maybe 1 pound, like in 2 weeks.
Okay.
Yeah.
Just like that?
Just like that.
Can you take just one and you are okay, or you have to take a minimum of a certain number?
You don't take one and then you're okay. You have to take it for some time. And once you reach your goal, we sit you down and then we go over it with you if, you know. But we actually do not recommend stopping like abruptly. Like, okay, I've reached my weight loss goal, so that is it. No. You can taper it off slowly. Yeah.
But is this something that you have to be on for a lifetime, like say, or when you take it after the period?
It depends on the individual.
Okay.
Yeah.
There are people that just can do without cravings. It's like they have to eat. So this is actually going under studies now to see if it's possible that these people can stay on this medicine for life.
Okay.
And at the moment, it should not be any life-threatening to anybody. So think of it, if you were diabetic and your doctor decided to put you on this medicine, you're going to be on this medicine for the rest of your life. And I feel like the longer you do this also helps check your lifestyle. Portion control becomes natural for you.
Right.
Because before, maybe you're eating like a full bowl of kenkey. Now you're cutting the kenkey into 4. You're eating just a little portion. And it's also in the brain. So if you've been able to train yourself for the last 6 months, the last 9 months, the last 3 months, it becomes a habit. Then we also highly recommend you changing your lifestyle.
Okay.
Because this is just not a magic shot you get and you're done. No, you have to be disciplined. And that is where you really enjoy the long-term effect.
Okay.
Yeah.
And losing weight, it's not just about just losing the weight. It helps with so many other things. If you're cutting your cravings, if your appetite is not that high, think about it. Cholesterol, we get cholesterol from the foods that we eat.
Yeah.
So if you're eating a full bowl of food and now you're eating half of it, that means you're eating just half of the cholesterol, right? So it's going to help with your cholesterol.
Okay.
It's also going to help with your blood pressure. If you have a healthy